From the headlines that move us
to plays on the field and people making a difference.
It's news, sports, and stories that keep our community alive.
This is the heartbeat of Tampa Bay.
I'm Christopher Ingram.
And I'm Bridgette Bello.
Yes, you are. Thank you for being here, filling in for Serena again, Bridgette.
Absolutely. Thanks for having me.
You brought us a wonderful guest.
I brought you an amazing guest.
Tell us about her.
Yeah, this is Dr. Rashmi Roy. Her and I have known each other for a couple of years now, and she is doing incredible things. We've worked together not only from an informational perspective, but from an actual hands-on perspective, and she is the senior thyroid surgeon at the Hospital for Endocrine Surgery.
That's a mouthful, and you did that without a cue card.
I
Nice
did.
job, Bridgette.
Yeah. So it's actually been more than a couple of years. So we first did our first event in 2022.
Okay.
So it's been 4 years, or about 4 years since we've been doing this. And that's kind of when I found out or realized how important thyroid cancer awareness was. Because the thing about thyroid cancer is that there's no symptoms and it's not detected in blood work. And so that's when my passion for spreading thyroid cancer awareness really started.
And it's the number, I'm going to
Fifth.
5. I was going to say 5. Okay.
Yeah, so it's the quickly rising in thyroid cancer, in cancers, and it's the 5th most common cancer in women, and that's just becoming more and more common. Now, if you hear about it now you're going to hear more and more people that either know someone or have it or had thyroid surgery. It's just, I hate to use the word pandemic, but it really is kind of like a pandemic.
Well, I can give you anecdotal evidence. Her and I have worked together on an event for 3 years, and in those 3 years, 27 women had findings or cancer.
Wow.
Out of a population of about 70.
Wow. Just thyroid.
In 3 years.
Wow.
We saved 27 women's lives potentially in 3 years.
Yep.
And so that's why I'm so passionate about it as well.
So if there aren't any markers in blood work and other typical signs that you would find cancer, how do you detect that someone has thyroid cancer?
Yeah, so it's either that your physician is, you go to the doctor and the physician is feeling your neck, or your OBGYN, obviously for women, they're feeling your neck, they feel a lump or a bump in your neck. And then that just kind of makes you go down the road of an ultrasound and biopsy and things like that. Or what I hear all the time is, I had another test done. So let's say men got a carotid artery ultrasound and then they found a thyroid nodule, or they got a CT scan for another reason. So it's what we call an incidental finding, and then we do the workup and it's found to be thyroid cancer. So it's usually, serendipitous that they find it.
Is there a typical age when people might come down with thyroid cancer, like we see in a lot of other cancers? You hit 50 and you get your colon checked and that kind of thing, or is it just all over the board?
So it's all. This week I operated on a 6-year-old girl, but I also today operated on a 76-year-old man. So it's the full gamut. But the most common age, especially for women, is between 30 and 50 years old. So these are women. You're in the prime of your life. You think, I just had a baby, or I just had kids, or my kids are in school, everything's going great, and then bam, a thyroid cancer diagnosis. So,
well, and one of the things that I think is super interesting that I wouldn't expect you to ask because you're not a woman, but
thanks for clearing up on that, Bridgette.
Last I checked. But one of the things that I think is really interesting is we are told, get your mammograms annually, get your pap smears annually, right? And so a lot of us are like robots. It's like a lot of us aren't, unfortunately. I personally, clockwork, get my mammogram, breast cancer survivor, so that obviously has an impact on it. But we're not recommended to get our thyroid screened, and it's the number 5 cancer diagnosis in women.
Right.
There's something really wrong with that.
So there is, and that's kind of what I've been championing now for 3.5 years, and I keep hitting a wall because I'm going against the grain. So the American Thyroid Association, the American Association of Endocrine Surgeons, they do not recommend screening. And the reason for that is because you'll find incidental nodules, and then all of these findings overwhelms the healthcare system, right? But I think, and I'm not telling you what to do if you found a thyroid cancer. If it's a small thyroid cancer, some institutions, they'll tell you to monitor it. We are not proponents of that, but some institutions will. So if you want to monitor your thyroid cancer, that's great, but I think you have the right to know that you have it and then make a decision. And so I've become more and more passionate with it because of the data that I have gotten with my ultrasound program, screening program. And so the detection rate for thyroid cancer in my ultrasound screening program is 2.4%. Now that may not seem like a big number to you, but mammograms and pap smears, which are routine tests, have a malignancy detection rate of less than 1%.
Wow.
And that's standard. So, you know, I'm really trying to push it. I write papers and abstracts and I submit it and I get them rejected, but I'm just, you know, I keep on going.
And that's why I wanted to have her on the
She's
show.
a fighter.
Because she is.
We
but
like
the
fighters
more
here,
we get the
especially
word
her.
out
Yes.
about this,
If anyone's a
the
fighter,
more-
Bridgette's a fighter.
Absolutely.
I'm working on that. I'm working on that.
In a good way. In a good way.
But when I hear her in my head, you know, we all have these things. Every time I clear my throat, I hear Rashmi in my head. And I didn't learn that until last year, by the way. And that's after being pretty, I mean, I'm probably
In
as
tune.
close to understanding
Wait,
as
explain
anybody.
the clearing your throat.
So that's one of the indicators that
Okay.
you should get screened. And I have been clearing my throat a lot. And I said that last year when I had the opportunity and I was too busy and I didn't get it done. And so I'm like, I was thinking this morning, can I ask her to do it? And then I'm like, she can't bring all that stuff on. But then I'm like, oh, we
We
can
do it
do
right
it
here on
live.
the show. Yeah.
Yeah, because it's that easy. It's literally a sonogram where they just put the stuff on
Right.
and look at it and they can give you results, which was really amazing. Like I said, these last couple of years that we did this event together, but to watch the fear on the people, like they didn't have to tell you, they just got findings, you could see
Right.
it,
Yeah.
right? And then it's like, how is that not something that is mandated that's so easy that you just
Right.
go in and they go like this and
What
you don't have
is
to take your clothes off.
Right,
Put your
right.
feet in
right?
space.
You're,
I mean,
right, you're
Yeah,
relatively
it's
comfortable.
not invasive.
no.
What are some of the repercussions for having thyroid cancer and post surgery? I take it as a very common. I mean, tell us, like,
Right,
what
yeah.
do you normally do, and then what are the outcomes?
Yeah, so the goal when I do surgery, I want to try to obviously cure your thyroid cancer with the most minimal operation. So all of these women in my screening program that I have found have been diagnosed early because they didn't know it, and I was able to cure them by just taking out half their thyroid. And so if I'm able to save half your thyroid gland, then you have a 50% chance of not even needing medication. And so that's huge, right? But sometimes it's a little bit more involved. There could be lymph node involvement, and then the whole thyroid needs to be removed. Those patients need to be on a lifetime thyroid hormone replacement that we start you on right away. And so women always ask me, if you take my thyroid out, am I gonna gain 50 pounds? And the short answer is no. You know, there is an adjustment period, 2 to 3 months, to kind of tweak that dose appropriate to your body mass. But after that, I mean, I don't expect you to miss a step. I expect your life to be exactly the same, except now you maybe need to take a pill every day.
Got it.
Well, and I've seen the women, a lot of them were my personal friends. You can't see the scar. She does an amazing job, and it's a teeny tiny, from what I understand, incision. And it's literally all in one day. You can get diagnosed, have the surgery, be cured, and walk out and go home all in one day.
Right. So that's
In the same place.
That's amazing.
Yeah.
Right?
So that's very special to our hospital, the Hospital for Endocrine Surgery, right here in your backyard in Tampa. So we developed this program where you can come in with, you just know you have a nodule, let's say, but you don't know anything else. So we do our own ultrasound, look at your thyroid, look at all the lymph nodes in your neck. We do a biopsy right then and there. We have pathology at the bedside. So if you think about, you know, going to get a test for some reason, you make the appointment, 3 weeks later you get the test, 3 weeks later you get the result, 3 weeks later, you know, so it's
And
this
the whole time
drawn
you're not
out.
sleeping.
Right.
Right.
It's agonizing.
And we do it in that morning, and then your surgery's that afternoon. And if I just take out half your thyroid, you're home that afternoon.
Wow, that's amazing.
Which is really unlike any other place in the country.
Wow. Another question for you. Is there a self-exam that people can do, like women would do with breast, looking for cancer? What does that consist of?
Yeah, so I call it your neck check. You basically #neck
Hashtag
check.
neck
So we did a campaign several months ago for #neck check. And so basically, just like women do breast cancer exams or self-breast exams, you should just feel your neck, right? First of all, just your thyroid, so it lives right above your collarbone, kind of 2 finger breadths above your collarbone. You just want to feel that area. And then just in circular motions, you just want to carry that out all the way to your ear and just feel for any lumps or bumps. So get to know what your neck looks like. And this is for men too. I mean, just because it's more common in women doesn't mean men should be not paying attention. So get to know your neck. Every couple months, you're in the shower, you're putting lotion on, look for lumps and bumps. If you find one, number one, don't freak out. Go to get an ultrasound, and then if it's anything, then you find an expert, thyroid surgeon.
Go see you.
Yeah, preferably.
That's who I would tell you to call.
Because when people don't come to see us, then we're dealing with patients' second, third, fourth, fifth operations, and it's a nightmare. And so you just need to get it done right the first time.
Well, Dr. Rashmi Roy, we appreciate you being here today. You want to tell us again what the hospital she's at?
Now you put me on the spot. I didn't
I'm just
feel
kidding.
good before.
Do you have a website or anything that you can share with us for our viewers about how to learn more information or anything about
yeah,
thyroid
absolutely.
cancer?
So the website is thyroidcancer.com. So thyroidcancer.com. Don't let the website scare you. You very well may not have thyroid cancer, but you may still need surgery. So if you want to become a new patient, there's a tab there. It says become a new patient. It's very easy. You click it, fill out the form. Or if you want to have a screening program at your office, there's also a tab to contact our team that sets up the screening program.
So just to elaborate on that, because she's a doctor, not an orator, they do those for free.
That's awesome.
If you have a large female population of employees, she will come out with her team. They bring the equipment. It takes literally not even 5 minutes. There's no mess, no fuss, no taking your clothes off. Again,
I just gotta say, that sounds a little discriminatory. You'll do it for men too, though, right?
I would.
It's not the
but it's just more common.
Okay.
It's just more common in
fair
women.
enough.
But if men are there, I'm not going to turn you away.
And are you still doing your podcast?
So my YouTube channel.
Oh, sorry.
So YouTube channel. So I have a YouTube channel. It's called Goiter Guru. And so
we'll put that up on the screen.
Right?
yeah, and
Goiter
so
Guru.
it all started because I started taking out these huge goiters like this big, out of the neck that go into the chest.
What is a goiter?
So a goiter is an enlarged thyroid.
Oh, okay.
So
Why don't they just call it an enlarged thyroid?
because goiter is much more fun to say.
You couldn't say enlarged thyroid guru.
Yeah,
Sucks,
goiter
so,
guru
yeah.
sounds
Got
better.
it. That's true.
So I started doing all these goiters that no one else would do, or other surgeons would have to crack their chest open to get it out, and I just do it through a neck incision. So it was more of a fun thing to show, and then it just kind of caught on fire. So I have, I don't know, maybe 56,000 followers on there. And so I made it into an informational channel, so I talk a lot about just any thyroid disease that needs surgery, things like that, and just information.
Very cool.
Goiter Guru on YouTube.
Goiter Guru on YouTube. We'll
Yeah.
put that on the screen. You'll have to spell it out for us. Okay?
Absolutely.
All right. Well, thank you for being here.
Yeah, this was awesome. It's a lot of fun. Thanks for having me.
Absolutely. Thank you for being here. I
Yeah.
appreciate you and your friendship and what you're doing for this community.
Always, always.
Every story shared,
Adds another heartbeat to Tampa Bay.
from courage to community.
We're proud to tell the stories that keep our neighborhoods strong.
Thanks for watching.
Thanks for watching Heartbeat of Tampa Bay.
You did pretty good that time.
No, thanks.
Thanks for coming.
Yeah, absolutely. It's very fun.